I'm Julie Zenner. Here's what's coming up this week on Almanac North. How are nonprofits faring during the uncertainty of the COVID-19 pandemic? The Duluth Superior Area Community Foundation and other grant-giving organizations are stepping up to help. Grand Rapids-based ElderCircle is finding a strong need for its services during the pandemic. We'll have more on that organization. And Duluth's CHUM prepares for COVID-19 and its potential impact on the area's homeless population. It's all coming up on Almanac North. Almanac North. Thank you very much for watching. Dennis Anderson is home tonight and our show was recorded on Thursday afternoon. We're adapting the show again this week to help keep everyone healthy with physical distancing and limited crew here in the studio. Some of our interviews were recorded ahead of time through video conferencing. Well, we've been seeing and hearing a lot about the huge economic impact caused by the COVID-19 pandemic, but there has been less coverage of the plight of nonprofits, which are often on the front lines during times of struggle. Joining us is Holly Sampson, Executive Director of the Duluth Superior Area Community Foundation. And Holly, welcome and thank you very much for coming in right now. These are very trying times for everyone, but what are you hearing from nonprofit leaders in our region?
So this is a really critical time for nonprofit organizations, and they are really struggling. It's really a time of crisis, Julie, for many different organizations. So, you know, we think about the amazing nonprofits we have in this region and thinking about Grandma's Marathon, you know, a nonprofit that had to cancel the marathon, and Hartley Nature Center, and a wonderful environmental organization, has had to close their doors, and you know, the human service organizations that are serving our most vulnerable populations. You know, we're really, all of us as grant-making organizations, and hopefully the whole community needs to really support our nonprofits at this time, because like healthcare workers that we all think about every day who need, you know, protective personal equipment to keep them safe, you know, the staff and volunteers of our nonprofit organizations also face those same challenges as they work with individuals across the community. So, you know, we hear about the Damiano Center, for example, that has closed its community kitchen, but is now giving free meals curbside, you know, in a bag. So they're doing breakfast, lunch, and dinner during the week for very low-income people who really need that kind of service today. So they have been impacted on many fronts, and I think it's really a critical time for everyone in the community to support the nonprofit organizations.
And the foundation itself has been impacted by this. You've had to kind of change the way that you do business in your own offices too.
Absolutely. We're all working remotely now, just like all the businesses across the community, and that has gone well for us. But you know, the financial challenges that nonprofit organizations will face because they're no longer having fundraising events, and they, you know, really rely on those fundraising events for their operating revenue. Organizations that rely on ticket revenue, so the Duluth Superior Symphony and the Minnesota Ballet, you know, those are organizations that that have events throughout the spring, and those, of course, have all been canceled. So the revenue stream for operating support for nonprofits across the board is diminishing really quickly. The other, you know, really support system is, you know, the many volunteers that nonprofit organizations rely on. And so today, it's really difficult for volunteers to step forward. We've been fortunate that some have been able to continue to do that, but nonprofit organizations will be faced with having to hire additional employees to fill the gap that volunteers have filled in the past.
So the Duluth Superior Area Community Foundation and other organizations in the region have come together recently to set up COVID-19 response funds, two of them, one in Northeast Minnesota and one in Northwest Wisconsin. Talk a little bit about that and who those partners are and what they bring to the table in terms of maybe mobilizing resources.
Absolutely. So there are 5 of us, grant-making organizations, who have come together. So it includes the Ordine Foundation, the Northland Foundation, the Lloyd K. Johnson Foundation, and the head of the Lakes United Way. So they are all partners with us that are working on the Northeast Minnesota Response Fund, and then we'll be working with the United Way as a partner on our Northwest Wisconsin Fund. So during these especially challenging times, and we worked together in 2012 when we were all working on our flood recovery. So we have experience coordinating our grant making. So we have just started meeting. We are now meeting on a weekly basis. So we are both trying to raise additional dollars for both of those funds through the Community Foundation. And then we will be working together to really distribute those dollars that will go to nonprofit organizations who are really struggling and serving primarily the most vulnerable in our community. We will also be making grants from each of our institutions as well. So we'll be coordinating our grant making so we make sure that we can spread our dollars throughout the region.
So in terms of area nonprofits being able to access these funds, do you envision kind of a fast-tracked grant process, application process, and distribution process? How do you see that occurring?
Yeah, so that's a great question, Julie. So as we think about our guiding principles for our grant making right now, it's about being flexible. It's about being able to release programmatic restrictions when we have an opportunity to do that with grants that we all have in our current grant making cycle. It's about a very rapid response. So we have put together with the due diligence that we need to do and the review that we will do with our 5 partners, we expect to really accelerate the decision making. So from the point of first contact to getting the check out the door, we expect that to last no longer than 2 weeks, which is really accelerating what we would typically do. And then we also, as I mentioned, want to focus on the most vulnerable. So those are the guiding principles that we'll be working together on.
Any ideas, how the size of these grants that might be available to organizations, or you say organizations that work with the most vulnerable, do you examples of the kinds of nonprofits that you expect to really have these dollars go to work for?
Yeah, so first really on the priority list are certainly those that have residential programming. So organizations like the services that CHUM provides at the Steve O'Neill Apartments, and you'll hear a little bit more from Lee Stewart about the great work that they're doing there. The Safe Haven, which is of course a shelter for women and children, and of course we've seen, as is true all across the country, increased reports of domestic violence now that so many states have stay-at-home mandates from their governors. So we think about Harbor House over in Superior, which is a homeless shelter and some permanent and supportive housing. All of those organizations that provide residential services to the most vulnerable are just like healthcare workers. They're really at risk, just like healthcare workers are today. But there are many, many other organizations that I mentioned that organizations now, because as you asked, we're working remotely. We have had to put in new computers, new software systems. All nonprofit organizations that are working remotely have to incur those additional expenses as well. So those organizations that need to adapt to the new working environment will certainly not have the funding because it isn't something that they anticipated in their 2020 budget. So there are a lot of specific needs that we know will be, I mean, we're already, Julie, receiving many more requests than the funding that we each have available can support. So that's certainly one of the reasons why we're coordinating our grant making, but also why we need to raise additional dollars from the community to really support these organizations.
And how has that community response been so far? It hasn't been up and running for real long,
Right,
but is
right.
it a strong start?
Yeah, so we really just, we just announced these funds, and it was great, it was really great to have the initial press coverage that we had early on. So, many donors have already stepped forward, but we'll continue to do some announcing of that fund. And again, we really want to see that both of those funds grow in a significant way.
Mm-hmm. Now, you have been with the foundation since 1990, planning to retire this summer. We only have 30 seconds or so, but what a swan song this is for you, going out to be, at the helm at such a critical point. Any thoughts on that?
We're working full speed ahead. I have a fabulous team, and obviously this kind of work, takes an entire team to put this kind of work together. So, it's just been, Julie, a pleasure and a joy for me to work at the Community Foundation and just all of the amazing stakeholders that we have. I feel so fortunate to do what I've been able to do. So,
all right. Well, Holly
thank
Sampson, thank you so much for your decades of work with the Duluth Superior Area Community Foundation and all you've done for the community. And good luck as you move forward trying to mobilize these resources to address this pandemic. It's really a strange time, and we really need organizations like yours. Thank you.
Thank you.
Well, senior citizens throughout our region are at the highest risk of death from the coronavirus. Yet these same seniors are often in need of services that require human interaction. ElderCircle in Grand Rapids provides many of these services in rural northern Minnesota. Almanac North producer Greg Grell talked with ElderCircle's executive director Renee Bymark about how it is adapting during the pandemic.
ElderCircle is a nonprofit that serves older adults throughout Itasca County and northern St. Louis County. And our mission is to empower older adults so that they can maintain active living and healthy independence by providing resources, referrals, and services.
And you actually are working more than one county, correct?
We do. We serve the full county of Itasca County, and the northern St. Louis County. We've just recently started serving in that area.
And then parts of Couchiching County as well?
Parts of Couchiching County, our RSVP program, which is the Retired Senior Volunteer Program, also serves Couchiching County.
Now, one of the things we talked about before the interview is that you have a great service for older folks, and that's grocery delivery. And I understand that's really gone up during this COVID epidemic.
Correct. So we have been doing the grocery shopping and delivery service for quite a while, and we serve an average amount of clients weekly, but we've seen a large surge since the COVID-19 pandemic. Last week to this week, we had a 47% increase in the amount of orders, and I expect to see that increase overboard week over week, just due to the need of people having to stay home, and the longer that they're home, needing to have their groceries brought in or meals.
So how does that service work? You use a lot of volunteers, I understand.
We do. We utilize quite a few volunteers. On an average week, it's about 22 volunteers. With the increase, we are going to be exceeding over 30 volunteers per week. And as we see the need grow, we'll have to increase that too. So how that works is people will call and set up an account, and we set that up with Super One in Grand Rapids on the south end, or the main area of Grand Rapids and the surrounding area. So the order takers will take the orders on Tuesday, and on Wednesday morning, the volunteer shoppers show up and do the shopping for all the orders, and then the delivery drivers, who are also volunteers, deliver those groceries to the homes. One change that has come of the COVID-19 is we do a non-contact delivery. So groceries are left at the door, we knock at the door, leave the groceries. And some of the facilities that we deliver to, we actually just leave those at the front with the administration, and they actually deliver those groceries to each person's apartment or room.
Now, with everything that's happening and the increased demand for your service, I know you're looking for more volunteers, and some of your volunteers are in that age group where they're also maybe not able to do what they used to do. So volunteers are really needed right now.
Correct. A lot of our volunteers are at the age where they're at high risk of exposure to the COVID-19. So we have had some volunteers who have needed to step away. We have had many volunteers from the community reach out. And then we've also been working with the District 318 since they are still having their staff work. They have been able to afford a few volunteers who have shown up and help us do the grocery shopping.
Well, that's great, and I know we'll give people more information as how they can volunteer towards the end of this interview. But one of the things you also do is you provide free medical transportation for people. Talk about that program a little bit.
So that's our assisted transportation program, and we give rides to any kind of medical appointment, but with, of course, the changes in our situation now, the only rides that we're being able to provide are essential rides, which that could mean to dialysis, chemo appointments, or surgical procedures that are deemed necessary at this time. So people would call and set up and enroll in this program. You do need to be 60 plus and live in Itasca County or Northern St. Louis County. And we do have volunteers who are giving those rides. And of course, we put a lot of precautions in place to protect our clients and the volunteers.
Another thing that you provide is in-home care, direct care from workers. And I imagine now with the COVID-19, things are changing with that a bit.
Rapidly changing. And our direct care workers are still going into many homes. Some they are unable to serve because if a person is living in a facility that is under a lockdown right now, we're unable to serve them. But we have had quite a few calls of additional people who need that help. And that can range all the way from helping them get their groceries, cleaning the home, and some personal needs that might need to be met while they're in the home.
You also do something, I think you call it the telephone reassurance calls. You've got a big database of people that you want to make sure are doing all right.
Correct. And that's actually brand new, and that has come out of the need from the community. So we have started doing telephone reassurance calls, and that is just placing calls and spending some time on the phone with people. And we are utilizing the database of people that we have touched in the past or currently serving. But we're also, if the community has people who they feel should be reached out to, they are more than welcome to reach out to ElderCircle. And we'll add that person to our list. And some of our concerns that we're addressing with those calls is just, are they able to connect with family and friends still via phone? Because that social isolation can be such a concern. Also food security, and are they getting their medical prescriptions? We know that with the changing times that prescriptions can also become another one of those challenges of people being able to get. So that's actually another service that we have now incorporated due to the situation.
And I imagine with many of the more rural residents in Itasca County and Northern St. Louis County that that kind of isolation is an issue, especially now with everybody having to stay at home. So that kind of service sounds like it could be really valuable.
We're finding that those phone calls are very welcomed and people are enjoying those. And I can honestly say the staff and the volunteers who are making those calls have expressed that they have really enjoyed being able to reach out and help somebody and maybe even link them to another resource that they might be in need of.
What would you say, Renee, are some of the more critical needs right now as far as your organization goes, the places where you really could use some help right now?
I think our basic need will be our grocery shopping and delivery. In Grand Rapids and the surrounding area, we do that on a weekly basis, but more rural, we try to match clients with a one-on-one volunteer who can meet those needs. Again, there's not contact in the home. It's all can be done over the phone besides going to the grocery store, making those orders and then dropping them off at the door. So that's going to be our biggest need is the more rural areas. And then the prescription delivery to finding volunteers who maybe can help out with that.
And finally, Renee, how can people get in touch with you if they do want to help volunteer in some way?
To get the most immediate response, I would call ElderCircle at 218-999-9233. And we are currently working off-site, but we have access to all voice messages. We are taking care of those daily.
All right. Well, Renee Bymark, the Executive Director of ElderCircle, thank you so much for spending time with us, and good luck going forward. Let's hope everything goes well.
Thank you so much for having us.
The homeless population is particularly at risk for contracting the COVID-19 virus, and Duluth CHUM is making preparations for a potential outbreak in the homeless population that they serve. Greg Grell talked with CHUM Executive Director Lee Stewart about the situation.
The advisory from the CDC is that encampments, and we're taking that to mean camping as well, is people are not to be disturbed from that. We're really just going to have to work with the city, work with everyone to make that as safe as we can possibly make it. In fact, at Gloria Day, one of the difficulties was maintaining the physical distance that was required. Last year when we did the warming centers, we only had about 20 people a night. We regularly had 40 people at Gloria Day, and it was a smaller space. And so as COVID-19 came up, we were really beginning to worry about maintain the physical distance. So during the last week of operation, we changed our rules a little bit so that people began to make the adjustment, and people were really, really great about, gratitude for having been able to have it over the winter when it was cold, and very grateful for the gear that we were able to distribute. And we needed to work a lot with Loaves and Fishes providing most of the staff for that. CHUM itself is still going to be open overnight, but we've changed that a little bit to anyone who wants to come in can come in. Last call for bed check is 9 p.m. But if you don't want a bed, you can stay up in the drop-in center, but you can't go in and out all night. Once you decide to leave, other than for a regular break, we really can't have you coming back in and out.
With the threat of COVID, that it's really changed a lot of the procedures and screening. You talked about that a little bit. Is that adding a lot of extra steps and stress to your staff?
It's stressful, and people are frightened because, along with everyone else in the universe, we don't have enough personal protective gear. And the CDC is also changing the guidance about what we should or should not be wearing. I have had some, again, good support from St. Louis County safety and risk management people about the kind of protective equipment that people should get eventually when we actually have something happening. So I'm pleased with that. We'll be part of a larger order to get people equipped to it. I'm finding, as in all things, good information and education and listening and group problem solving, goes a long way towards the anxiety. Our biggest issue here is that, over the last couple of days, for all of March, we've averaged over 90 people here at night, and that's both in the beds, usually around 50, 55, and then in the drop-in center from maybe 20 to 40. And that's a lot of people in a small space when part of what we're trying to do is physical distancing. And so that's why it's important for me to be working with the city and the county on some way to thin out CHUM so that we can, we've got to flatten the curve in Minnesota, we've got to flatten it in Duluth, and we have to make sure in place that congregate shelters, all congregate living. You can think of us like same as a nursing home. We're a lot of people and not much space, and so we need to make sure we can flatten our curve here too.
Okay, and one of the last things I understand is that CHUM is actually looking for people and hiring people that you do have some staff needs.
That's right. We'll be, by my estimation, in order for us to fully staff an isolation and quarantine facility of the size that I'm using Seattle as a model. Seattle recommended 40% of the people in the population would be ill, 40% would be really ill, and 15% would need ICU. So if I do that on the homeless count in Duluth, I need about 120 beds. And so in order to staff something like that, I think I need 18 people to make sure that the different groups, because there's a group of people who are waiting for tests, a group of people who are positive, there are a group of people who have been released from the hospital and still need some kind of care, but are not sick. and they're people who've had contact with anyone who's positive. So you need to have those groups separated, and you need to have kind of staff identified for each of those groups. So that's why I'm thinking of 18 people. We have about 5 lined up now, and so tomorrow I'll be putting out, or Thursday I will have a media advisory about that. The application site is already live on the CHUM website, and so we encourage people, if you're interested in helping out, we'll make sure that you have the protective gear. You'll be operating under very close coordination with St. Louis County Public Health, and we know by standing together we can help with some of the most vulnerable people. It's really important. The people who are experiencing homelessness are vulnerable for a lot of reasons. One, they live in crowded conditions. The second, they have underlying health conditions. Many are elderly. Many have other, other sorts of disabilities that get in the way, and they don't have any place to go. So we're happy that they come to us, but we want to make sure we have a safe place for them no matter where they are on the COVID trajectory. And so we need about 13, 15 people. Be short-term employment, probably 3 months, but I know a lot of people have lost their jobs, and we'd like you to consider helping out.
Information about the COVID-19 quarantine facility jobs and a link to an application is available on CHUM's website, chumduluth.org. Well, if you're feeling ill, Essentia Health and St. Luke's both have hotlines that they are answering 24/7 to help you. Take advantage of those and other resources available online as we all stay close to home to flatten the curve of the epidemic. And while you are at home, keep up with Almanac North on our social media channels. You'll find us on Facebook, YouTube, and Twitter. And visit the WDSE website for program updates and more about COVID-19 special programming. Stay healthy. For the crew here at Almanac North, I'm Julie Zenner. Thanks for watching. We'll see you next time.